Hi everyone, my PowerPoint presentation today is on improving the quality of care for the diabetic patient. Quick little background on diabetes, which I'm sure we're all very familiar with. There's 3 types. Type 1 diabetes, less common, occurs mostly in children, definitely a genetic component, only accounts for 5% of the cases, so you can see it's a very small percentage. Type 2 diabetes far outnumbers type 1 and gestational, most common form of diabetes. This is the one we're going to talk mostly about. This is the one we can definitely make an impact on as far as quality of care. Gestational diabetes that you get as a result, it's an onset, takes place during pregnancy. Most of the time resolves. Again, we can make a bit of a difference here, as sometimes it won't resolve due to our habits. How does it affect our quality of health care? We can look at the numbers in the pie graph and we can see just how much money is spent on diabetic care every year. Quick little statistics. I'm a numbers girl. I like my numbers. Currently, they're saying 29.1 million people have diabetes in this country. Staggering, especially considering the majority of those are type 2, which again is within our control. Cost, again, of diabetes, we're spending an enormous amount of money, about $15,000 a year of money spent on a diabetic patient compared to a non-diabetic patient. And you can see where a lot of that money is coming in prescription drugs and, of course, hospital care, because as a result, we're going to have complications, which are going to result in hospitalizations. More numbers, more cost of diabetic care. Again, just reiterating some of the high costs and how they compare to the non-diabetic patient. Staggering number. $825 billion a year is what this disease is costing our country. How do we compare with other countries? I think both in quality and in cost, it's pretty clear. The United States, we're only 3rd in the number of patients who have diabetes, the number of people, yet we're number 1 in how much money we're spending on the cost of diabetic care. So, for example, we're spending we have 29.3 million people with the disease compared to China's 109 million, yet we're spending roughly 3 to 5 times the amount of money that China is spending. When I did my research and looked into the reason for this, I found that China does a lot more of a holistic approach towards diabetes as far as their care protocol, whereas the United States is more of a treat each symptom as it arises type of a care. Diabetes is projected to only increase, which is a hugely frightening statistic. We're already in this area somewhere, and they're saying that we're going to be all the way over here by 2025. So this is something that if we don't improve the quality of the care given to these patients, this is going to continue to burden our system. So how can we do this? How can quality of care be improved? Definitely can be. Studies have shown type 2 diabetes can be reversed in most cases. It's about exercise, it's about eating, it's about patient education. Some things already in place in our system. We already have a physician quality reporting system. I don't believe it's as efficient as it can be. I think we need to make some changes in that. I think that physicians need to be held more responsible for their role in diabetes care. Patient-centered care, huge. I don't think care is patient-centered right now. I think it's disease-centered. I think we treat the illness, not the individual. Meaningful use of our electronic medical records. I think there's a lot of potential out there for apps and for electronic medical systems to record and keep data on these patients, so we can follow up with them and see how they're doing. Standardized outcome measures, already again in place, just a matter of refining and making them better. Collaborative care, doesn't really exist. I think we need it. I think our providers need to be communicating better. I think we need to have more of a team approach that's going to improve the quality of care. Everybody on the same page. Pre, intra, and post-office visits. Let's educate our patients. Before they come to the visit, they know what to expect. During the visit, we need to give the patient education. How they can manage their disease, the tools that they can use to manage their disease, nutrition information, exercise information. Let's not just medicate them and move on. So, question, can we decrease the incidence? I believe we can, absolutely, without a doubt. Can we improve the quality of care? Yes. Again, I believe we can, without a doubt. These are my references, and look forward to a world with less diabetic patients. Thank you.